And what's been happening? Is that Brett Michaels from Poison?
Yeah. Somebody gave me the shirt. I'm not really big.
All right, I was like, I'm a big Brett Michaels fan. And I was like, all right, you're my favorite person all day. He's the lead singer to Poison.
Yeah, like the guitarist nowadays.
Uh-huh.
The guitarist is doing pretty well. Richie.
So Ricky Rockets, their drummer, CC DeVille is their guitarist, who apparently was big on drugs for a while, but he's good and clean now. Yeah, but Brett Michaels, he also has a little country thing he does.
Mm-hmm.
So Miss West, what are they gonna do? They're gonna yank some wires out? Are they bothering you, or broken, or fractured?
They're broken.
And so is your sternum clickety and clackety?
Oh yes. Oh God, yes.
Ain't that something?
It's horrible.
I know. I hate when these things happen. You know, they gotta go there, pull the wires. Sometimes they have to put reinforcements in there. And Dr. Badier's gonna do it?
Yes.
And you have a mitral clip? Or what do you got in there? You got some stuff in there. I think that's a mitral clip. Okay, that's an atrial appendage clip, okay. And when you walk around, do you get extremely breathless and winded?
Now, since it's done, yeah.
Before that, no?
No.
And how long you been smoking, dear?
50 years.
Hot diggity, man.
Longer than you've been here.
Right at it. And did mom and dad smoke around you?
Yeah.
Okay.
I guess I could say.
And have you ever been told that you have COPD, emphysema, anything
No,
like that?
no.
Okay. And then at home, do you use inhalers and puffers? And
I got an inhaler after this was done. My general practitioner gave me.
that's just fluid in the fissure. So on your CAT scan there, you got a little spot there.
Where?
Your right upper lung. And we don't like to see smokers get lung spots, because some of those lung spots can sometimes, yeah, it's not in the fissure. Well, it's right off of it. So you have a tiny little spot about a little bit bigger than this in your right lung. The spot is tiny, it ain't gonna give any symptoms of chest pain or shortness of breath, but obviously anybody who's a smoker past the age of 60, a lung spot can be a cancer.
Yes.
So we have a couple of options. One is we could try to get a biopsy of that little thing, because the earlier we diagnose a cancer, the better people do. Or we could say, well, let's get another CAT scan in 4 months and hope to God that that thing is gone, smaller, or not grown. The risks of doing a lung biopsy are pretty darn small. It doesn't involve any pain, cutting, or hacking. It is done while you're asleep. No, it can't be done at the same time that you get rewired. But we do the procedure under general anesthesia, so you're asleep for it. The procedure itself takes maybe 15 minutes, so you're not under anesthesia very long at all. And I use a special robotic scope system to get to that little tiny lesion and take some little biopsies and samples of it. And the procedure is anywhere from 90+% accurate, depending on certain things when we get in there. So very often if we biopsy this stuff and it says it ain't a cancer, we can very often trust our results rather than saying, okay, well, just in case we should do this or that or that. You've got some fluid on that right side as well. That may be from previous surgeries, but the fact that you have a nodule and fluid on that right side, it kind of increases the index of concern. Now, when I first looked at this nodule, it almost looked like you had a little bit of fluid trapped in the lung, in a round little ball. It could still be that. But long story short, till we have a chunk of tissue, we're just kind of guessing what it could and couldn't be.
Well, instead of doing a biopsy, could you not just take it out since it's so small?
Well, what if it's normal?
Well, it's out of there.
So would a chunk of your lung and a big chunk of your rib. So no, you don't just cut it out.
Okay.
It's kind of like saying, I have a flat tire, let me go get a new car. You just fix the tire. Likewise, you got a lung
Well, I
nodule.
have done that before.
So
My husband sent me to get the tire fixed, and I
came
thought,
back
well,
with a
maybe
new
it
car.
wouldn't.
You met a good salesman or a pretty one. But anywho, this thing needs to be biopsied
Sure.
or watched closely. I would recommend getting it
That's
biopsied
what I want.
because the risk factors for the biopsy are infinitesimally small. This procedure won't interfere with you getting rewired. I would probably say get this done before your procedure, because I think the recovery from this is going to be some time. The recovery from my procedure is nothing. There is no recovery. You wake up the next morning, that afternoon, and that's it. You go home. Whenever I've seen people get sternal rewiring done, depending on what happens when they get in there, they're like, oh, they needed a chest tube, or they needed this, or they needed a plate. We're gonna watch, and then you're very sore, and the last thing you wanna be doing is get put to sleep again, and the anesthesia doctors would be all worried about it. So that's what I would do with you. We'll get a little breathing function test on you here in the room to kind of see what your lung function, lung capacity is, so we have a little bit of an idea. And then otherwise, I'll tell my nurse what we need to do. Medication wise, I'd probably, if you're allowed to do so, I'd want you to stop your aspirin. Yeah. Yeah.
Well, I guess you'd have to talk with my
Like,
cardiologist.
do you have a bunch of stents in your heart?
No,
Okay, then you can stop it.
it's triple bypass.
Yeah, so you stop your aspirin. And then that's it, nothing to eat or drink the night before. Now this procedure, the way it happens is, again, nothing to eat or drink the night before. You come to the hospital that morning, anesthesia doctors, they'll put an IV in you, ask you 1,000,001 questions, and then we'll take you to where we do our procedures. They'll put you completely to sleep, and then you'll wake up. Now the risks of doing a lung biopsy is, we have to stick a needle in it. And so anytime you stick a needle in a lung, the lung can deflate or collapse a little bit. That's not a complication, it's just a consequence of getting a needle shoved in your lung. The chance of that happening is anywhere from 1 to 3%. People who smoke or have bronchitis, emphysema, COPD, that incidence is a little bit higher because their lungs are a little delicate. So whenever we're done with the procedure, we get a chest x-ray, make sure both lungs are up. If the right lung is deflated a little bit, we'll leave it alone. If it deflates too much, then we'll put a tube in there under sedation and let that little cut that we produced, let it glue itself overnight by itself. And then the next morning we'll pull the tube out and that's it. Okay. But that's what we need to do.
When do you want to do it?
You're about to find out. Any questions for me?
I don't think so. So this will be, will I have to stay in the hospital or will this be a
No, it's an
procedure?
outpatient.
Okay.
Let's see what you sound like here. In and out. Okay. Be right with you, Miss West.
Okay.